All right, hello, my name is Madison Tate. Here's my badge. I'm going to do a quick run around of my room. All right, so first thing I'm going to do is I'm going to plan for medication administration. I'm going to minimize any interruptions. I'm going to close the medication room door. I'm not going to accept any phone calls. I'm going to keep conversations with a colleague to a minimum unless it's very important or pertinent information. And then I'm going to follow the agency's policy of a no interruption zone. All right, so first thing I'm going to do is I'm going to take this order form and the MAR, and I'm going to compare patient. I see Jaguar J. Jones, date of birth 8/25/1963, 8/25/1963, medical record number 4176352, 4176352, and I'm going to see that he has an allergy to penicillin and an allergy to penicillin. So we're going to be seeing which medication we're going to be giving, which is heparin. The dose is 5,000 units. The route is subcutaneously, and the time is every 12 hours. The indication would be deep vein thrombosis prophylaxis. All right, so now we are going to put our order form to the side and perform hand hygiene, and we're going to do our first check of the 7 rights. So we're going to look at the MAR. We're going to see patient Jaguar J. Jones, the date of birth 8/25/1963, medical record number 4176352, and we see an allergy to penicillin. All right, and then we are going to grab heparin for the right medication. Here it is on the vial. The expiration, it is not expired. And then for the dose, we're going to see on here that it says 10,000 units per milliliter. And the order asks for 5,000, so we're going to give 0.5 milliliters or half a milliliter. So we're going to clean our vial. And we're going to use, for the right route, we're going to be using the tuberculin syringe because it is a subcutaneous injection. And we're going to take this top off and put the safety on, and we're going to aspirate to 0.5 milliliters because that's where our dose is going to be. So we fill that with air. Take the safety off and put it in the vial, push that down, and then we are going to withdraw 0.5 milliliters, making sure that there are no bubbles. All right, very nice. I'm gonna take that out and cover that up and show you that it is 0.5 milliliters. All right, so now we have that. We're going to see, we talked about the right route. We're going to talk about every 12 hours, the correct time. Patient hasn't had it in the past 12 hours. And then we're going to talk about the right indication, which would be deep vein thrombosis prophylaxis. In the right documentation, it has all aspects making it a legal prescription. All right, so after that, we are going to perform our second check. So we are going to check for the medication. We are going to take the vial, the heparin vial, and put it next to our heparin on the MAR. And then we are going to check for the dosage. It says 5,000 units, and that's 10,000 units per milliliter on the vial. So we would do 0.5 milliliters, and we would match that up right there, subcutaneously with a tuberculin syringe, and every 12 hours for the correct time, the correct indication, which would be deep vein thrombosis prophylaxis, and right documentation, meaning it has all correct aspects, making it a legal prescription. All right, now, so after that, we are going to take some tape and make our label for the syringe. All right, so on this, we are going to include the patient's name, so Jones, Jaguar J. We're going to put heparin, which is the drug or the medication, and then the dose, I'm going to put 5,000 units and 0.5 milliliters on there as well. All right, so now we have our label. Jones Jaguar J, heparin, 5,000 units, 0.5 milliliters. And we are going to place that on the syringe, making sure it is not on any important numbers that we will use later. All right, there's my label. So now that that's done, that's after the second one. After the second check, we are going to begin with the third check. We are going to go to the patient's room, and we are going to do hand hygiene. We are going to explain the procedure. We're just going to give 0.5 milliliters of heparin, and we would raise the bed and lower the side rail. Then we would begin the third check for the rights of patient, the 7 rights of patient rights. Anyways, so we're going to check, this is when we use the armbands, this right here. And we are going to see, okay, on this MAR, we have Jaguar J. Jones on the armband. Date of birth, 8/25/1963, 8/25/1963. Medical record number 4176352, 4176352. I see allergic to penicillin, and then I would ask Mr. Jones, are there any more allergies that I should be made aware of? He says no. Okay, awesome. And then we would do the pre-administration assessment, whether that be blood pressure, pulse, any like lab values such as platelet levels, and a pain assessment. So we would do that, and then we would jump into the right medication. So we can look at our syringe as well as the vial that we have here. So the correct medication, we have heparin. We have 5,000 units, which is 0.5 milliliters, which is the dose. We have subcutaneously with this tuberculin syringe, the time every 12 hours, and the patient hasn't had it in the past 12 hours, and the right indication, which is deep vein thrombosis prophylaxis, and the right documentation, which means that it has all of the correct parts, making it a legal prescription. All right, so after that, we would put on gloves and goggles. We'll perform hand hygiene, and then put on gloves and goggles. And we would explain that we are going to be doing this at the abdominal site because that is the preferred site for heparin injections. And we would check that area for any abrasions or bruising. So now I'm going to grab another alcohol pad, and I'm going to clean this going from the inside, like towards the site, and going out. All right. Now with this, I'm going to say that I can pinch 2 inches of skin, meaning that I can go into this at a 90-degree angle. So I'm going to pinch 90-degree angle, go in, inject. All right, take that out, place that in my sharps container, and then I would observe the patient for any allergic reactions. I would document the procedure. I would take first I would take all this off with glove to glove, and then wrap that up, and then skin to skin. All right, that goes in the trash as well. Take these goggles off, and then I would observe for any allergic reaction from the patient. I would document the procedure, like what time I did it, the dose, the drug, all of that good stuff. And I would position the patient comfortably, lower the bed, raise the side rail. Yeah. Thank you.